All right, everyone. Good afternoon and welcome to another Lindsay Memorial Lecture hosted by Alzheimer Group. I am pleased to be the host for today's lecture because today we have our one and only Joan Foster, who is a registered nurse and community worker for, I won't say how many years, but Joan works in the community on the front lines, and she came to us a few years ago with a presentation like this one today, and it just provides so much wealth of information for those who are living in the home environment. So I'd just like to thank the Lindsay Memorial Foundation for sponsoring today's lecture. It is a webinar, so what you will see at the bottom of your screen, for those of you who are listening, there's a chat function and a Q&A function. So I will be asking Joan the questions that you might have. Please feel free to write whatever you'd like in the chat. Joan is always open to answering any questions, and if we don't have the answers, well, we'll help you find them. So. Without further ado, Joan, welcome and thank you for coming today.
Thank you very much, Megan. Thank you, thank you. So as Megan said, my name is Joan Foster and I'm one of the home care nurses that works out of the CIUS. I work out of the Benny Farm home care program and have since 1976. And it's my pleasure. I love AGI, and it's really my pleasure to help in any way that I can to help you, the caregivers, care for the people so well that you care for. So the focus of my presentation, and I really want to make this clear at the beginning, is that I am not diagnosing in this lecture. For example, if we talk about I have a headache, that is a symptom. There can be a number of causes of a headache. There can be the person who is dehydrated, the person whose blood pressure is too high, the person who didn't get enough sleep the night before. There can be a number of reasons for the headache. So the focus of my presentation today is on symptoms. Symptoms are what you see at the moment, and that's what we're focusing on. I am definitely not going to be diagnosing anything in this conversation. And as Megan says, thank you so much to the Lindsay Foundation. It's an amazing foundation, and their ongoing support helps support AGI in this lecture series. So I'm assuming you can all hear me well. If you can't, then please let Megan know. And as Megan said, if you have questions during the presentation, put them in the chat. If Megan feels they need to be answered right away, she will let me know. So one of my jobs that I had as a parent was I was a brown owl. And so to me, it's really important to look at the term be prepared. Be prepared is something that is so important for us, especially when a crisis happens. I'm talking to you because, as you know, as time goes on, you're going to need more and more people in your team to help you care for the person that you love. And these caregivers could be everything from paid caregivers to family members, to even if you had to run out to the store, it could be the neighbor next door who is come in to be with your loved one while you run out the door. So I'm a really firm believer that we have to be prepared in the event that there is an urgent situation. If someone has allergies, I really believe in the Medic Alert Bracelet program. So that's a good thing to be prepared. When I go into homes, I constantly set families up with what I call my 911 envelope. And in this 911 envelope, you have a copy of the Medicare card, a copy of the hospital card, a list of medications from the pharmacy, a list of contact names and phone numbers, and as well, and this is a whole lecture that I'm not even going to go into today, but a good form is the government level of care form. If you have decided on specific levels of care for this individual with them or as the mandataire, it's important that that be there. The 911 envelope is so important because if the person who is with your loved one suddenly has, collapses or something happens and the person has to call 911, all they have to do is hand this envelope to the Urgence Santé when they arrive. They don't have to run around looking for pills and looking for the wallet or the purse with the Medicare card. It's all right there. I usually tell my families to put the 911 envelope by the front door or tape it on to the back of the front door. But if it's a house where you can't leave it out for fear it'll go missing, then you have to have a specific place like on top of your fridge or something, and be sure to let the caregivers know where the 911 envelope is. And that is just, to me, critical. The third thing is have a little mini first aid kit in your house. I'm not talking big. I'm talking, Band-Aids, maybe a baby aspirin, a few gauzes, and a wrap to wrap around in case the person has a cut that needs some cling around. It's a very, very simple first aid kit, but you should have something in your house. If you don't, it's not the end of the world. You can use all sorts of things, as you're going to hear from me, but I think it's a good idea to have a first aid kit. So the hardest thing that you're going to have to do when a crisis happens is leave the person and call for help. It's the hardest thing to do. Trust me, I've been in these situations and it's really hard. But basically what you have to be able to do is get to the front door, unlock the front door, grab a phone and go back to the individual and call 911. Calling 911 is not an automatic trip to the emergency. It's calling in support for you in the decision making. And that's really important. I would say that most of the people who call 911, maybe only 50% end up that the decision is that person should go to the emergency. But how wonderful for you to be able to say to your family members, I called 911, they came, they checked dad or mom out, and they found that they were just fine and everything is okay. Don't worry about us. You might not have to call 911 right away. I mean, if it's a nosebleed or something like that, you might not have to call 911 right away. But if it gets serious, it's even harder to break away from the person, open the front door, unlock the front door, and grab the phone. So I really feel that that's something that we really have to do, is when someone falls or when someone is not well, you've got to be prepared to call 911 right away. I hope I'm not talking too fast. If I am, let Megan know. So let's talk about the different symptoms that I talked about. So if somebody suddenly has what we call a syncope attack, or that they look like they're going to faint, the main thing is that you don't want this person to injure themselves. So that if you find that the person is standing there and suddenly like they're not communicating with you and they're starting to sway a bit, you've got to get that person flat. You've got to just ease them to the ground, no matter where it is. I've been in situations where I've been grocery shopping and I've seen that someone's not doing well. And as terrible as they think it is, I ease them to the ground right there in the grocery store. Because if they go unconscious and they fall, they could hurt themselves. So you get a person flat. The pictures on the side show somebody putting the legs up. That's not really the most important thing to do. You have to loosen clothing. Sometimes the reason the people are fainting is because they're all bundled up in winter clothing and have gone into a grocery store and they're too hot. So you've got to loosen clothing. And what that means is that if the man has a tie on, you got to loosen the tie and undo the button. If you could even go undo the coat. You can't get the coat off of them when they're lying down. If you can go under a pair of pants, sweater and undo that tight button on the pants. And God knows we've all got tight buttons on our pants right now with the COVID weight we've put on. But you've got to loosen the clothing so there's nothing constricting them. You have to let them have plenty of air. And like you pick up anything and you just fan them. It's a matter that they have a lot of air. And then often people whose blood pressure has fallen, they get really cold. And so you have to keep people warm. So if you can grab a blanket or something and put it on top of them, if you're in a grocery store, you take off your coat and put it on top of your loved one. But we're mostly talking today about when this happens at home. So I made a referral to the grocery store now, but I'm mostly going to be talking about what happens at home. But at home, you've got to get the person down flat. You've got to loosen their clothing. You've got to make sure they've got air, and you have to keep them warm. It's very embarrassing for the person for you to assist them to the ground, but trust me, it's where they need to be. Those 4 steps to a chair or those 5 steps to a bed might not be a good idea. If the person is bleeding, let's say that they've cut themselves badly, they were in the kitchen and they were chopping away and they've cut themselves, or let's say they fell onto something that really cut their leg. Again, you don't want them fainting. So I don't sit people in a chair at home when they're cut. I get them flat. I get them flat in the kitchen. I get them flat in the bedroom. I get them flat in the bathroom. And then you apply pressure directly to the bleeding area. If you're in the kitchen, if you're in the bathroom, you can just grab a towel and use that. If you're somewhere else in the house, you can take anything that is clean. If they're in the bedroom, for example, there might be in the drawer a clean hanky or something, a cloth hanky or a clean t-shirt, anything clean, and apply pressure directly to the bleeding area. You don't know, again, we're not diagnosing. You have no idea why this person is bleeding so much. But what you know is you want to stem the bleeding because the blood does not belong out of our body. And so it's really, really important that we lie them flat and put pressure right on the bleeding area. And you don't have to press down so hard that you cause them pain, but you've got to put pressure. You got to put some pressure on that bleeding area. Now, if the person has a nosebleed, the worst thing you can do is to put their head back or lie them flat, because the blood will go down the back of their throat and into their stomach. And blood is great unless it's where it doesn't belong. And some people can react quite violently to blood being in their stomach, and they can start vomiting. Well, if you start vomiting, all it does is increase the pressure in your head, and that makes the person have a bigger nosebleed. And so I say that if you've got somebody who has a nosebleed, they either sit forward like this with their hand on a table or on their knee or whatever, or you lie them on their side if they're feeling woozy. You pinch the nose and you don't peek. You don't peek for at least 5 minutes. The average person takes about 2 minutes to clot blood. Most older people are on medication to prevent a stroke, and they're going to take longer. So you pinch the nose and you don't peek for 5 minutes. What's going to happen is the blood that is there in the nose is going to clot, and it's going to stop the bleeding for whatever reason they're bleeding in the nose. If it's possible, if you keep these like a couple of little ice packs in your freezer, it's always a good idea. You're going to hear me refer to them more often as I go along. But if it's possible, just put a little bit of ice pack just above the nose. That cold is going to help slow down the blood too. So you can put a cold cloth on it and then pinch. You can put a little ice on it and pinch. What we're trying to do is we're trying to slow down the circulation to that area. And if we can slow down the circulation, then the nosebleed is going to stop. Now, again, we don't know why this person is having the nosebleed. It could be their blood pressure is too high. It could be they have a little blood vessel that's burst in their nose. It could be that they knocked their nose on the door frame walking through when you weren't there. But the thing is all we're trying to do is stop the bleeding. That's the most important thing to do, is to stop the bleeding. Just see, I'm doing okay for time. All right. I'm used to talking to people in person, so this talking on Zoom, I have to keep all these variables in line so I know what I'm doing.
You're doing great, Joan.
Now, my husband, he has a really hard time going to a restaurant with me, because I'm a nurse. As much as I'm his wife, I'm also a nurse. And I go into first aid mode all the time. And one time, Bill and I were sitting and we were having a lovely meal in a restaurant. It was really going well. And I all of a sudden saw that at the table next to me, this poor waiter had tripped on something, whether it was a handbag that had fallen over that was on the floor, whatever, and ended up pouring boiling soup on this lady in the table next to me. And I jumped up, ran to the table, grabbed the ice pitcher, the ice water pitcher, and I threw it on where the soup had landed. And like everyone in the restaurant are looking at me like I am some absolute dodo from God knows where. And my husband is just so mortified, and the waiter's looking at me. And anyway, basically what I did was I stopped the burn. Because when you have a burn, be it a burn from a stove or a burn from boiling water or a burn from a fireplace or whatever, you have the initial burn, but then your body reacts by rushing blood to the area which has white blood cells in it to try and heal that injured tissue. And there is so much blood that goes to the area that that's when you blister. That's when you get all these blisters on a burn. So that if you, the minute you burn yourself, can get that hand under cold water. Now, there was obviously no tap next to this lady in the restaurant, and maybe you're going to be in a house and the person is not that mobile, and they're eating their soup off of their lap, and their soup bowl tips and goes onto their groins and their thighs. And I've seen some terrible blistered burns on thighs. But hey, the sofa's dirty anyway. The person's clothes are wet anyway. So if you can go to your fridge and you grab the cold milk or the cold juice, or if there's cold water in that fridge, and you come out and you pour it immediately onto the area, you stop the burn, because all that hot is being kept in those clothes. And so it's like the burn is continuing on because of the clothes being boiling hot. So cold water to the site as soon as possible. And as I say, everything is dirty anyway. And if you take a liter of milk and cool it down, you're doing that person such a favor. Then you remove as much clothing as possible. Now, obviously, I couldn't remove a lot of clothing in the restaurant with that poor lady who's sort of staring at me like I'm crazy, but you remove as much clothing as possible, and then you get the cold on it, because you're trying to cut down the circulation to that area. With this one lady, I gave her my name, I gave her my number and everything. And I called her the next day. I asked her if I could come by and see her. And she said, she said, I don't have a blister. I can't believe it, but there isn't one blister. And so that's what it's all about. It's all about preventing the secondary damage. Okay, it's all about preventing that burn from continuing. I can't stress that enough. So I once burnt my hand because I was talking while I was pouring boiling water into a cup. I mean, accidents are accidents. They're all stupid, but they happen. And I was pouring boiling water into a cup and burnt my hand. And it was late at night. It was a cup of tea before I was going to bed. I literally put a chair at the side of my bed, and I had my hand in a turkey pan with water and ice. and I went to sleep with my hand in that, and in the morning I had no burn. So Megan, you've got a question.
I do, because I think there's sometimes some misconceptions. What about ice? You know, some people say they may not have access to water, but you know, I've heard people put ice on burns.
Ice is fine. There's no problem with ice. It's just, it's quicker to grab something cold out of the fridge than to break up some ice from the freezer. Now, if you've got a bag of frozen peas or something up in your freezer, then, and it's big enough to cover the whole area where that soup burnt, well, then sure, bring it out and put it on a bag of frozen peas, a bag of frozen corn. But what you're trying to do is you're trying to get the heat out of the clothes.
Okay.
Or if it's, there's no clothes, like in the picture, the hand, you put your hand under the cold water, or you put, a bag of frozen peas or frozen blueberries on top of your hand. So I have no problem with ice. That's not a problem. Cold is great. It's just, you've got to stop the heat from doing the secondary burn.
Thank you.
You're still going to be red, and you're still going to have some sort of a burn there. I mean, the skin is going to probably peel and it's probably going to be sore, but believe me, you'll have far less of a burn if you act right away. Anyway, my husband, luckily he's been spared with COVID. He doesn't have to take me to restaurants for the last 14 months. So he's a happy man, but I'm just saying that that's the name of the game, is to stop as soon as you possibly can to stop that secondary burn. Now, when someone has broken something, we really do not want to move that arm, that leg, that elbow, that shoulder. You don't know if it's broken. You're not going to know if it's broken until you get an x-ray, and there's no x-ray machines in houses. But you really don't want to move the affected part. And there's many reasons for that. If it was a fracture, it might be impinging on a nerve. It might be very, very close, the shards of the fracture, to a major vessel, blood vessel. So you really don't want to move the affected part. You'll notice that when a child hurts themselves, like if a child hurts their arm, the first thing they do is put their arm against their chest and hold it. In other words, I don't want you to move this. This is a natural thing of ours, not to move an affected part. So that if somebody has injured their shoulder, injured their elbow, injured anything, don't try and straighten out the arm. Don't try and straighten out the leg. Whatever position that leg is in, leave it. If someone has fractured their hip, usually the leg is in what we call a frog position, where it sort of falls out from the pelvis and then the lower leg goes back into the center. But please don't move the affected part. Wait for 911 to come. They know how to move. They know how to check the pulses. They know how to move that limb to stabilize it, to get it for an x-ray. So that's really, really important, not to move. You apply ice if possible, or cold, no heat. The worst thing you can do, again, you can imagine if you took a raw chicken leg and you broke the raw chicken leg, look and see all the damage that you've done to the chicken meat. It's impossible to break a bone without really injuring all the surrounding tissues. And so if you apply heat to it, you're going to make them swell more. You're going to make them hurt more. You're going to perhaps even injure the skin. So it's really, really important that you do not apply heat. You can apply cold, and sometimes there is a fracture that breaks the skin. We call these open fractures, where unfortunately the bone has broken and then gone through the skin. You don't see the bone through the skin because often it moves back into place, but the skin is broken. And if the skin is broken, you have to, as soon as possible, protect that area because you don't want infection in that area. So you need to protect that area with either a tea towel, a pillowcase case, a sterile pad if you happen to have one in your house, but you just have to protect that area that skin if it's broken. The most important thing about fractures is that just don't move the affected part. The person is not going to want to move it. And you're not going to want to move it either. And I'm not talking about first aid accidents that happen out on the street where the person is lying in the middle of a busy road. You know, that's a different story because the most important thing is to get the person to safety. I am talking about someone who falls at home and injures a bone at home. So again, I'm talking about home here all the time. If somebody gets something in their eye or injures, you know, like falls and it looks like they've cut around their eye or anything, don't ever intervene with an eye injury. What I always do and say to people is be sure to just cover that eye. I don't know if you can do this now, but if you cover your eye, you will see that you don't blink. Now, if you only cover one eye, you will still feel the blinking of your other eye. So that's why if you don't want blinking, if the person has a little shard of wood or something plastic in their eye because they've broken a glass, you don't want the eyelid blinking on the eye. And so that's why I say to people, I am so sorry to do this with you. I am not leaving you alone, but I have to cover both of your eyes. Because if both eyes are covered, there's no blink. And you can practice this at home and you can try it, but you'll see that if you only cover one eye, you can still feel that occasionally the lid is blinking down. And so it is so important that you cover both eyes until the appropriate people come. It requires a specialist to irrigate an eye. It requires a specialist to remove a contact lens if it's in an eye that's injured. This is not something that we're going to do. So whenever there's injuries, or we need our eyes, whenever there's injuries around eyes, I have always said, leave the eye alone, cover both the eyes, and get yourself some professional care. Again, if you called 911 and they came and assessed it and they were able to flush out that little bit of sawdust or whatever, then that's fine. They might say you don't need to go to the hospital, but I don't want you being the person to make that decision, okay? I think it's really, really important. Chest pain. Chest pain, again, we're talking about the symptom chest pain. Chest pain can be indigestion. It can be someone who's having lack of oxygen to their heart. Chest pain can happen because somebody has coughed too hard and they've gone and cracked a rib. We're not diagnosing here. We're just talking about the person who suddenly says, gee, I'm having pain in my chest. Again, we want to facilitate oxygen. So you loosen the clothing and give them plenty of air. Now, I was once, again, as I say, my husband, he doesn't go with me to things, the poor man. But I was once helping out at a holiday meal for seniors. And, when you go out to a holiday meal, you get all dressed up. And around the house, a lot of people now, they wear loose clothing. They might wear Lululemons, or they wear track pants or something. And then suddenly they have to do up their skirt or do up their pants. And it's quite tight in the middle. And so some people, if they're at a holiday meal, they're going to eat more than they eat at a regular meal. The food just kind of loads up here and the stomach pushes up and there's less air for the lungs. And so people start saying, oh God, I'm having trouble breathing and my chest hurts. And it might be something as simple as we got to undo the belt. But I always say, when anyone says, gee, I'm having trouble getting air, I'm having some pain in my chest, the first thing I do is I loosen their clothing and I give them plenty of air. And if you're in a group setting, it's a natural thing. We all want to help each other. So in a natural situation, everyone's going to crowd around to see if they can help. And you as the first aider, you just have to say, move back. So if you're having a Seder in your house, or you're having a big Christmas dinner in your house, then the thing is, the best thing that can happen is the rest of the family leave the room. And if there's another person there, you're not alone. They're the ones that call 911, and you loosen the clothing and give the person plenty of air. People who are known to have chest pain usually carry a nitro spray with them. And this is something that is ordered by doctors. And what nitro spray does is it opens up the blood vessels, it relaxes them so that more oxygen gets to the area. So it's like a Charlie horse of the heart. I mean, as a simple way of putting it, when you're running and you haven't run for ages, or if you're doing some exercise and suddenly your leg goes into a spasm, it's because you've overworked those muscles. And so they've all gone like this, tight, tight, tight. And if you just stop and just wiggle your foot a bit, then the blood vessels relax, more oxygenated blood gets to the area and the cramp goes. Well, it's the same thing with the heart. The heart goes into sort of tightens and gives someone pain. This nitro spray, what it does is it then opens up the blood vessels and allows the person to have, it usually will take away the spray. Now, the rule of thumb for nitro spray is 2 puffs under the tongue. So the tongue goes up and 2 puffs, 1, 2, every 5 minutes for a maximum of 3 doses. If that pain has not gone away after the 3rd time, then definitely you call 911. You don't go for a 4th time, because it means that just the simple nitro spray is not what's going to be needed to get away this chest pain. So it's really important that you don't just keep on with the nitro spray hoping that it's going to work. But as I say, chest pain can be caused by many, many things. If you happen to have some baby aspirin in your house or an aspirin in your house, when someone's having chest pain, it's not harmful at all to give them an aspirin. Now, circulating in the internet is this article that if you're alone and you're having you think you're having a heart attack, start coughing. I want to tell you, for any of you that have read that article or seen that article, it is totally not validated. There is absolutely no scientific data to that article that's been circulating for about 6 months. It would be called a Trump misinformation, or whatever it is that he used to call things. So no, don't sit there and cough. You chew a baby aspirin, you call 911. You chew a regular aspirin, you call 911. But the purpose for the aspirin is, again, to help with the area. So it's really important that if someone's having chest pain, that you loosen the clothing and give them plenty of air. Their chest pain might go away. If they're a known cardiac person, they always have a nitro spray with them. And if after 3 doses of the nitro spray, they're not looking any better, then you call 911. And I always say, they always say, no, no, no. And especially now in COVID times, everyone's going, no, 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 don't call 911. But the thing is that 911 won't necessarily take them to the hospital, but they will support you in your decision making. And you're the first aider, you're the first one on the scene. But the important thing is that you need the support of others to make a decision, because often the first person on the scene is quite caught up in it, and it can be very nerve-wracking. I've been in many a situation that I probably could have handled on my own, being a registered nurse, but I call 911 for backup, because it's just 2 heads making a decision are better than 1. I have 2 more. So I'm just going to keep you going for 2 more situations. I hope that's all right. When someone chokes, it means that there is something caught. We have, as you know, we have our breathing system with our trachea, and we have our eating system with our esophagus. And the 2 of them sort of are down here and move in different areas according to whether things are going to the stomach or things are going to the lungs. But if something gets stuck there, in food-wise, it can interfere with someone's breathing. Now, obviously, the best thing is make sure all the food is cut up really small so the person isn't going to choke, but that is not always the possible. When we get older, we lack a lot of secretions in our mouth. And so I usually tell older people that, of which I'm one of them, I say always start your meal with a little bit of a warm drink so that you get the circulation going in that area, because you can be quite dry in your mouth. And so if you just take a piece of bread as the first thing you eat, there's no saliva there to get it down and it can get caught. So the first thing you do is you say, are you okay? Try and get the person to speak. If the person can speak, there is no way that you can speak if there's no air moving, because the air goes through our vocal cords to help us speak. So the person could be there coughing and you say to them, are you okay? And they go, yeah, but I'm really having a hard time because I can't, as though there's something stuck. If they can speak, leave them alone. Because if you bang them on the back or bang them on the chest, you might take that little piece of food that's there but not fully obstructing and move it into full obstruction. So if somebody can speak, let them try and get rid of it on their own. That's, it's an automatic reflex. They will do what they need to do in order to try and get it out. Okay, so leave them alone if they're making any sound and are trying to dislodge the item on their own. Now, if you say to the person, "Are you okay?" and they go, and they're not able to make a sound, it means they have a complete obstruction there. And that's when you need to help them. And you can help them by thumping their back upward like this between their scapula, right there between the blades of their back, because that vibration could loosen that piece of something that's lodged. Or if it's somebody that you can't thump their back, let's say they're lying in bed and you can't turn them to thump their back, then what you do is you try and push upward like a J below their diaphragm to take whatever trapped air is below this thing and push it up so that it will dislodge it. Now, there are some good videos out there for learning about back blows and abdominal thrusts. If we were in person together, I'd be showing you with a dummy or someone. It's really hard to do it over a webinar. But the thing is, what you're trying to do with the back blow and with the abdominal thrust, either standing in front of the person in a wheelchair or getting your arms around the person if you can, is to try and dislodge that piece that is stuck there in their throat. And you know what, it's a difficult thing to do. It's very nerve-wracking. It's really hard to see someone choking. And most people who are choking on something can manage to get enough air that they're making a sound. And then, of course, we call, by that time, 911 is there. So it's really important that if I can't stress it enough, if somebody is able to answer you, no matter how terrible their voice sounds, they are getting air. And so the worst thing we can do is change the piece so that they're not getting any air. If the person is unconscious, you walk into the living room, you've been in the kitchen doing dishes, you walk into the living room and there's your loved one on the floor and they are unconscious. Again, remember what I said. Hard to leave them right away, but you got to open up that front door and get that phone. You can bring the phone beside the person and call 911. It's hard to leave someone lying flat on their back when they're unconscious because their tongue can fall into the back of their throat and cut off their breathing. So I know I said to you that, we try not to move people if we don't have to, because we don't know if they have a fracture and we might make the fracture worse. Well, to a certain extent, when someone's unconscious, you really have to try and turn them on their side because, number one, we need to make sure their tongue is not blocking their throat. And number two, if they vomited, they wouldn't then breathe in the vomit into their lungs. So to turn them on their side, the easiest way for your back or anyone is to turn them towards you. You get down on the side and you turn, they're lying there and you're on the side of them, and you put the arm, which is closest to you up in the air and you just turn them over on their side. Sometimes dentures are a problem. We change weight as we get older, and dentures that fit 5 years ago might not fit properly now. And some people have loose dentures. And so it's really important that if the person has dentures, that if you can get rid of them to make sure there's good air entry, that they don't fall into the throat, and just to make sure that they're not a problem. And then I talk about a finger sweep of the mouth. And this is mostly really for younger people, younger children, but also for adults who are eating or something. They might have gone unconscious because there's a piece of food that's lodged in their throat. And when you go in one side of the mouth and out the other, so your fingers like this, and you go like that, you can feel that piece of food. And sometimes you can feel the denture that has moved back and you can get it out. And so a finger sweep of the mouth is a good thing to do until 911 arrives. You don't know why the person is unconscious. You don't know if they just suddenly became low blood pressure. You don't know if they were choking on something. You don't know whether they're bleeding somewhere. Again, all we're talking about is the symptom. We are not talking about the cause. But the best thing you can do is lie them on their side, keep them warm with plenty of air, and make sure their mouth is clean, that there's nothing blocking, obstructing in their mouth. And that's a real crash course in 911 first aid. I have witnessed and been a part of and heard all these happening in my home care patients. And so I know these things do happen. And I know that they are extremely upsetting. And I know that sometimes we're just so worried about the person, we can't really think straight. So that if you have some idea of what to do, then it helps. If you have your 911 envelope, then that really helps. And never be afraid to call 911. The paramedics, the fire department, the first aiders, if you live in a community that has first aiders, first responders, they're all fantastic. And believe me, you are so happy when they arrive. And as I say, not always does the person have to go to the hospital, but if the person does, then they take care of it all. And you can just stand back and know that you did the best that you could for your loved one or the person that you're hired to care for.
Yeah. Joan, thank you so much. I do have a few questions for you if you have a few minutes.
I have all the time in the world.
Okay. I was wondering, just to continue your conversation about calling 911. I think that I've heard often that we have people who might have fallen. Okay, they might have fallen out of bed. They might have missed a step, especially with dementia. Your depth perception changes. You might have been sleeping. And some people might say, check to see whether or not there's any damage, if they're conscious, and then they don't call 911. I'm curious to know, people probably don't call 911 because they don't want to bother, and very often they just don't want their loved one going to the hospital, or getting that recommendation, especially during COVID, where often someone with dementia might be left on their own. So what would you suggest for people who might have a loved one who's fallen? They might have a little cut, they might have like a little bump, but they're still talking. What would you do?
Right. So there are two things that come to my mind that I talk about. The first is, if the person has fallen, and if by you assisting them to get back up into the chair or get back into bed, you go and put your back out and you can't care for them, then you've got double trouble. So sometimes caregivers will injure themselves trying to help the person who has fallen. So we have to always be aware of our own body's limitations. There are situations where sometimes the caregiver has osteoporosis and is half the size of the person they're caring for. And even if you only, I've had a couple of ladies that I've said to them, listen, even if all they do is come and get the person off the floor and back into the bed, go ahead and do it, because if you injure yourself putting them back into the chair or the bed, then what's going to happen? You're both going to need the hospital, because you can't leave them alone and you have gone and injured yourself. So that's my first thought, is that the caregivers always have to think of themselves. I was okay until you said, well, they've just got a little cut on their head. There was a coroner's case a number of years ago here in Quebec that basically someone was not sent to the hospital for a CT scan after hitting their head, and the person had a brain injury and died. And in the province of Quebec, and in other provinces too, but I know our province, anyone over the age of 75 who has hit their head, if they are assessed by anyone in the medical field, they must have a CT scan to rule out the fact the brain is the skull is a pretty hard skull, but still, if the person has fallen and bruised or hurt themselves or hit their head, fallen on a toboggan, watching their grandchildren toboggan or whatever, then it's really important they get a CT scan. Right now, there's a huge pilot project going on in Alberta where they are fitting head CT scan machines into one ambulance. And so what happens is that the ambulance that comes, 911, has the ability to do the CT scan right there, fire the result off to the emergency room, and the doctor there will say, okay, they don't need to come in. We're not there yet in Quebec, but I guess it's a really good program. And so there is talk of extending it into Quebec, but we're not there yet. And so it's really important that people know that if a head has been hit, a CT scan needs to be done. Okay. I was traveling with my husband visiting our daughter in the US, and he was busy. There's my poor husband being mentioned again, but he was he was busy looking at the turtles in the bayous. And he missed his step and down he went. And he said, oh, I'm fine, I'm fine, I'm fine, I'm fine. And my daughter and I looked at him and said, sorry, you got to go have a CT scan. Like, there's no way we're bringing you home to the house to have you go take a nap and fall unconscious. And then it's just not going to happen. So I think that calling 911 is good. Obviously, if the person sort of just slumped off the toilet and they're able to get on their knees and get back up and get into bed and they feel okay and nobody knows the person as well as the caregiver. So as a caregiver, if you know they're okay and they've done this before and they're okay and they can move their limbs and everything, then fine. That's absolutely fine. But if you have any doubt, you call 911. And as I say, only 50% of the calls to 911 end up being transported. Okay. Sometimes they're just putting them back into bed. Sometimes they're just making sure the caregiver is okay with this situation.
Joan, someone says your husband is a very lucky man to have you by his side. I'm not sure if you know this, but I don't know why people don't want to call 911. I'm not sure if, do you get charged if you call 911 and they don't bring you to the hospital?
No one over the age of 65 is ever charged for 911. Nobody on social assistance, what we used to know as welfare, is ever charged for 911. But you're right, transport of 911 for anyone else up to 65 and not on social assistance, there is a fee. But it's transport, it's not the initial first aid. Often the initial first aid is done by the local fire department. You'll find, that the fire department will come and to the door and, will be often the first people who turn up. Or in some communities like Côte St. Luc, it'll be the first responders that will be the first ones there.
Okay.
It'll be whoever is most available, and there's no charge.
Okay, and I always suggest to people to keep if they have a cell phone, to keep the cell phone close by, so that they cannot feel like they're not leaving that person for if they're on hold or anything like that.
I hear you, but the important, as I said, I mentioned two things. You got to open up that front door. Because, it's no use having 911, you're in the basement or you're in a bedroom and 911 are trying to get in the front door and they can't because you've got the bar bolt on the front door. So it's the unlock the front door or unlock the apartment door. There'll always be somebody to let 911 in downstairs, but unlock that front door and have the phone with you.
Okay. Someone was curious about, at the very beginning in your 911 envelope, about the level of care. Now, I just want to, before asking this question, we do have a part 2 of talking about palliative care, advanced care planning, and that with Zelda, who Joan, I know you know very well, Zelda and Patrick, in 2 weeks on April 22nd, I think it is. So you can get some of that information. But for Joan, I really...
I'll just do a brief now.
Absolutely.
In the province of Quebec and in Canada and in the States, there are 4 levels of health care. The first level is what we call level A, which is all the bells and whistles. So call 911, do whatever you want to do to try and make me well. That is the default. So if that's what people want, they want all the bells and whistles, ICU, tubes, surgery, everything, then we're level A. And you don't need to have a level of care form if you're level A, because that's the default of 911. That's the default of the hospital. Everyone is treated as level A unless they hear elsewise. There are some people, though, who say, hey, I'm 98 years old. I've had a really good life. Yes, I want to go to the hospital. Yes, I want to keep living. But if my heart stops, I've had a good life. Do not attempt to restart my heart. That's level B. And that there are a number of people who feel very strongly. They have that written in their wills and their mandates, but their wills and their mandates are sitting in a safety deposit box somewhere. So that's no help to 911 who come to the door. So if you're a person who does not want to have resuscitation attempted, and I say attempted because it's very difficult for very ill people to be brought back. But if you do not want that, and you do not want any extra, tubes to support you, then you have to have a discussion with your family physician. Now, the CLSC nurses, if you're connected, or anyone can download the level of care form from the internet. It's very easy to download. It's very, very clear They go into what each level is, A, B, C, D, D being palliative care. This person has a life-threatening illness and is expected to die within the next 6 months. That would be palliative care right there, the level D. But if you are level A, that's fine. But if you're a person any level below that, you have to have the form signed by your physician in your house, or 911 is obliged to do level A care. So that's all. Patrick and Zelda will go in at much greater length to it, but it's by the province of Quebec, and it's called the Levels of Care and Cardiopulmonary Resuscitation. That's the name of it, and you can call it up.
I Google that, and I really, one thing that I took away from the last lecture that we had was that very often with technology changing and, you know, your mandates, God knows how many years ago you did it and where it is, your level of care, this document, you can make your choices, you can make copies, but you can also make changes to it. You just need 2 witnesses. So it's, and it doesn't cost anything. So it's not like you have to go back to the notary to make the changes of your mandate. It's just, it's very simple. You need 2 signatures and you make copies, put it in files, give it to family, put it in your GP, and go from there. So,
and you can change. I had one lady that, as she was having more home care support, I sat with her and I said, you know, you said that you were a level B care, that you did not want to have your heart restarted should it stop. How do you feel about that? And she says, well, right now, maybe that's okay, but I might change my mind. I said, then that's fine. If you want to change your mind, then you just tear up that document. Like, it's not as though, you know, this is the be all and end all. Some people file this document with their hospital, but the bottom line is, if you change your mind and you say, you know what, I want to keep living, I'm really enjoying life, yes, I want you to attempt to resuscitate my heart, we have to listen to you.
Absolutely. Joan, this was so informative. I think everyone at all ages should have this. I know in the event of an emergency, it's very stressful for caregivers. You know, if it's happening to you,
terrible.
It's kind of like everything you learn just goes out the window. But I hope
even for me, I was with a dear friend the beginning of January who called me and she said, I think I have food poisoning. And when I went to see her, there was no way it was food poisoning. And it took me a while to let me call 911 and to find her purse and this and that. And while I was on the phone with 911, she arrested. And I'm telling you, that was the longest 3 minutes of my life, waiting for 911 to come through that door, because there I was, and I know how to do CPR and everything, but this was my friend. And so I tell you, it's just, that's why I say be prepared. And be prepared because of the other caregivers that are going to be involved. You know, if you can just hand over that envelope, 911 love that envelope. And it makes such a difference, because they don't come in as one person. So one person's reading the envelope while 2 are working with you on your loved one.
Yeah, it's stressful. I do say that we're happy that you're a friend of AGI's, and I think we need to clone you and bring you, because I know all the staff want you, and I know now, you know, all of our families are going to want you. So thank you so much.
Anytime.
I really appreciate it. We appreciate it. And if anyone needs any support, has any more questions for Joan, please don't hesitate to reach out to AGI. And we'll make sure to get your questions answered. I want everyone to go outside and enjoy the wonderful day, okay? So Thank you, everyone. Have a wonderful day. Thank you again, Joan, and we'll be in touch, okay?
Yeah, for sure.
All right, bye.
And you're all doing a great job. Keep it up. It's not easy to be a caregiver. It's not easy at all. And it's not easy to be the person who's not well either.
Yeah.
You know, we didn't sign up for this. And so I think that as long as we stay together as a team and support each other and be there for each other, that we can deal.
Yeah. Thanks, Joan. Have a great day, everyone.
Okay.
Bye.
Bye.